I am Tom Pelon. I've been calling Barb Brenda all week, and I don't know what's going on, but we are RPIW number 14, and this is the standard worksheet that we're going to be doing. My wonderful team is behind me. They did a lot of work all week. We have one missing member today. Her name is Carrie Palmer. She works for CVT Associates, and unfortunately, she is the sole relief for another member who gave birth at her office. So she's not with us today. You will see me later in the program filling in for her, so just imagine a young female doing that portion for you. And, our sponsors are Mike Higgins. Our process owner was Emily Jewett-Curley. We had a lot of stuff going on in here in the OR scheduling office. The current status was 1 to 14 days of waiting to get into the wait list. So that wasn't a good thing. We had non-standard packages, incomplete packages coming in. We had batching from offices, and we have 2.5 FTEs dedicated to just inquiries into the wait list from patients out there. There's about 8,200 patients out there waiting, and generally those requests come in soon after they see their surgeon because they want to know how long the list is. And of course, if it's 14 days to get into the list, nobody knows where they are in the list. So those were things that were brought up by our sponsor to reduce that lead time and make a defect-free booking process. So to do that, Michael and I showed up many, many weeks ago. We value stream mapped the process. We looked at all the weights. We'll go to the next one, Michael, just the value stream map. So we did all the steps in the process. We grouped it into areas of interest, into kaizens, where non-value add stuff is in the patient flow. So within that flow, there's many places where the paperwork just seems to become idle, and we wanted to reduce that time. So we did 4 kaizens, which you'll see with the group as they present, and we did a 5S project. We did also a lot of ideas on there about where the waste is in the system and how it's going to be removed.
Hello, my name is Regina McRae, and I had the pleasure of being a participant in this RPIW. I'm going to talk a little bit about the baselines and the targets for the week. First, in terms of inventory, there were about 22 different booking forms floating around the system. We wanted to reduce that to 1. The lead time for when the form showed up in the OR scheduling department until it was filed after data entry was 7 days, and we wanted to reduce that to 1 day. In terms of quality, the booking forms that waited around a maximum of 7 days, we wanted to eliminate that to 0. We had a mini 5S project that had to do with organizing the top of filing cabinets and a drawer where there's the surgical slates stored. That started out with a score of 1.6 out of a possible 5, and we wanted to raise it up to 3. In terms of setup time, sorting of faxes and the mail that came in for the day, we wanted to reduce that from about 63 minutes to about half an hour. In terms of cycle time, which is the time, the whole process from picking up the forms to doing the data entry and filing, we wanted to reduce that from 4 minutes to 2 minutes. And finally, our takt time calculation, based on the hours available, working hours available per day, and the demand, which was about 175 pieces of work to wait list and schedule a day. That meant that we need to work to a pace of about one of those pieces of work being completed every 3 minutes.
Hi, I'm Susan Rahutsky, and I'm a participant, and I'm a nurse at Dr. O'Grady's office. I'm going to talk to you about the Kaizen number 1. And that's the standard booking form and the booking package process. The booking form, we had a problem because there was 22 different booking forms that came into the scheduling office. This made it difficult to locate information for the scheduler and to enter it into the computer. It was difficult to train new staff, and more time was consumed. The idea was to standardize to 1 form. And since the majority of the doctors used the provincial form, we adapted most of the standard form to that. The process we've done was we've had asked every surgeon's offices to implement the new booking form. So 2 of those offices used the old triplicate copy of the forms. 4 of the offices used their own booking forms, and 2 of the offices used the original provincial booking form. And the outcome is that we already received 2 of these new standard booking forms, and also have a template to download the booking form from those offices, or for those offices that are on the Acuro system. So the standard booking form package we looked at next. The definition of a standard booking form package included the SSCN form, which is the surgical scoring tool, the booking form itself, the history and physical or letter, and then the signed consent. And the problem that occurred was offices or surgeons' offices send incomplete packages. Sometimes consents were not signed, histories and physicals were not attached, and they came in later. Patients are not put on the surgical wait list until the scheduler has the complete package. So if the package was not complete, the OR scheduler had to spend time tracking down all this missing information. So the process implemented, we did implement a standard work for the schedulers, which is in the process of being rolled out. And hopefully the outcome will be that the complete packages are received by the OR scheduling department from the surgeon's offices, and that they get the patient on the wait list sooner.
My name's Trina Weichel, and I'm an OR scheduler in the office there. And I worked on Kaizen 4, which was the review data entry with the Saskatchewan Surgical Care Network and the entry of the patients into our pathway systems. The problem we were running into is 2 things. Is the SSCN information necessary to be captured? And it was very time-consuming for schedulers to data enter a patient into the computer system when we have 2 different systems we had to use. So the process we did was we contacted the registry to see if the scoring tool was needed or is it for useful information. We discovered that there was only 3 types of surgery that need to be captured. And those were the cataract surgeries, heart surgeries, and cancer patients. So we implemented a standard work process to try and eliminate some of the entering of the tools into our system. So the outcome was, with having to enter this data into 2 systems, it took a scheduler approximately 3 minutes to put 1 patient onto the surgical wait list. By removing the surgical tool, it now takes us 90 seconds to put a patient into the system. We are still asking the surgeon's offices to send in the surgical tools. We're just going to trial not entering them for 2 months, and then we'll see with the registry if it's going to affect any of our data. And so without entering the tools, each scheduler will save 1 week of work, which is a total of 9 weeks per year.
Thanks, Trina. I am the surgical patient participant, so I am the one who has called into the inquiry line and said, "What? You don't know when it's going to happen?" So at least this gave me an understanding of that, and we have now improved that a lot. So I'm going to talk about Kaizen 3, which is looking at optimizing the patient scheduling. And I'm going to talk about the load leveling for the OR schedulers that we have there. There was this identified need pre-Kaizen to level their load, and so what did happen was there's 1 full-time equivalent staff coming in next week, which is awesome, and so the schedulers just were asked to put input in and how can they level the load, and Manager Emily is working through that process with them. The other big issue was this mail sorting. When the mail goes in there, it comes in many different ways, as you heard, and They have to take that mail, and the mail gets sorted, and then the urgents are pulled out so that they're dealt with right away, and then the others are filed into OR scheduler, a file area. And so, and ongoing through the whole day, these fax machines just come and come and come and come with all of these booking forms. And so they all have to be organized to the scheduler. This is a spaghetti diagram that was done of what happens with an OR scheduler. This time was taken out of their task of inputting the data for the booking list, say, and one scheduler would go, they would go to the mail, they would pick it up, they would take and sort it, taking the urgents to the 9 different desks, and then they would go back and forth to that fax many, 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 many times a day, and they would pull the urgents out of there, and then they would file all the rest. So we did time observations of that to see how can we take that out of their load that they have. And this was an idea summary sheet that we did. We did many, 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 many ones of them, and we wanted to get it down so that they did not have to, you know, do so much walking back and forth. And this one was unsuccessful, so we tried different ones in there. And post-Kaizen, what you can see then is the other piece that I didn't mention is they did look, there's an inquiry line group of individuals who work in there, and in the very beginning they looked and they thought, they have a little bit of time, perhaps this could go into their workload. And so we took all of the mail sort and the walking to and froing from the OR scheduler, and it was redesignated on a trial basis to the inquiry line. So now the inquiry line does this and not the OR scheduler. Really freed up that time for the OR scheduler. We had to do standard work forms because this was a new task for these, and we did a couple standard work forms for them, and we even trained them in it, and it's all checked off, and hopefully this process is going to continue.
Hi, I'm Chelsea Kripakevich, and I'm an OR scheduler. Prior to the RPIW week, it was measured that it took about 1 to 7 days to input data from the booking forms into the wait list. This was done at random times during the day, and in some cases it was batched right to the end of the week. When patients called into that surgery hotline, the booking package just may not have been entered yet, and that information then couldn't be given to the patient. So during the RPIW week, dedicated time was implemented between 1 and 1:45 every day for waitlisting. The number of booking forms entered by each schedule was then counted after these times, and it was determined that if the standard work continued, the average time for a patient to get on the wait list was then shortened to 1 day.
Hi, I'm Sandy Eitneier. I'm a participant in this RPIW, and I'm going to be talking to you about the Kaizen, about the single method of receiving the booking package. There are several different ways, and what I'm going to focus in on is the fax machine. We have 2 fax machines, and they are very busy, and they're constantly broken. And the manager did some pre-work, and she did some preventative maintenance on the fax machine, but it was actually still broke again this week. So what we would like is the electronic server that we can use for the fax machine, and we've encountered some barriers there, so our sponsor is going to work on those barriers for us. Thanks, Mike. And I'm also going to talk about the 5S that we did, and what was chosen was the top of the filing cabinets. As you can see, they were kind of messy. We had several different sizes of file folders. They were tattered. Things were hanging out. So we decided we actually found, we didn't have to buy, we found some new uniform-sized file folders, and we labeled them. And while we were doing this, on top of the cabinets was some binders, and we discovered there was about 3 or 4 months of old slates from one site, and another binder had about 4 months of slates. And we asked, why we were keeping these, and we found out that actually in the small department there was 2 different complete sets of OR slates for each site. So we were able to get rid of a lot of paper, and we did some standard work, and now we're keeping 1 month, the current month that we're in, plus 1 month, and that's for quick reference for the OR schedulers.
The Target Progress Report. This is a report on the stuff that we've done that's improved. The first line you'll notice in the space requirement, this is to do with the 5S project, and you notice how on day 1 we had a great reduction. This wonderful team behind me went and on my request threw out all the folders on top of those things. So it turns out that got me the Golden Throne Award, or Golden Toilet Award, I think it was. Which is actually a good thing, I guess. But during the wall walk on Thursday, they presented me with that, and it's a porcelain throne on a piece of wood. So they said it was because I listened to them after they put the folders back. So I'm going to go with that. But we ended up reducing that down only 14%, and I think it's a great idea. These people do know their workflow. So the inventory that we reduced, it was a number of booking forms. We think that there's 6 offices out there that are currently converting now to the new form. We have some work to do that we'll be handing over to the process owner at the end of this. The walking distance was converted from the scheduling clerks to the inquiry clerks, so we actually saved 100% of their time so they can actually concentrate on OR scheduling. The inquiry clerks had some downtime, so now they have more productivity in their workday as well. The part travel distance, we'll just go to the next one. That was the forms that were going around the department. We reduced the walking for that as well. With daily management now of the system, there was 19 forms on average that were waiting a minimum of 7 days in the system. So with daily management, the 1 to 145 that they talked about, that will be enough time to reduce the forms so that none of the forms stay in the system more than 7 days. We expect that to target to be 0, although there's a lot of work in progress because this was an area that wasn't dealt with quite before. The 5S environment is scored at 3.2, so they did a wonderful job of that. They increased it up to where it's a very productive environment. The cycle time for the whole event now with the SSCN tool being out of the entry is reduced that down again by 55%. So all in all, it was a very successful team effort.
Good afternoon. I'm Michael Redenbach. I'm sub-team lead for this RPIW. I'm going to go over some of our outstanding newspaper items. You've heard about the SSCN work and us wanting to get out of that. So as was noted, we're trialing it, but this will ultimately be a decision that has to be made collectively. So once we've done some trialing for a little bit longer, we'll talk with the ministry and find out where they want to go with that. Depending on that decision, we will then have to have some communication with our surgeons, and that will be undertaken or with the advice of the surgical program executive. A couple of other, we need to develop some standard work around the prioritization of booking packages. That will be done shortly. We talked about the fax server. That work is underway. We do need to have a overall communication strategy with the surgeons once we decide to implement the standard form. How exactly are we going to do that? And you've heard about the standard work. We still need to do the training associated with that. So our summary. Oh, let me just. That's okay. So you've heard we've developed the standard form. I should acknowledge that the bulk of that work did occur last summer with a fairly substantial exercise that was undertaken to develop the standard form. So we've tweaked it and are just moving it forward. And we've got it being trialed in 6 surgeons' offices. The 5S'ing has been done. We've stopped the SSCN entry. We've reduced the data entry time for pathways. We've reduced the workload for schedulers. We have dedicated waitlist time. So previously there was different ways in which the schedulers would do their waitlisting. Now they all do it at the same time every day. And we're developing, we've got standardized work for what happens when an inaccurate or incomplete booking package comes in. Now everybody's going to do it the same. And here's a list of folks we want to thank. I'll leave it up there for your perusal, but I do want to make a special thanks to Lynn, our patient rep, who's been super this week and has asked great questions and has kept us on our toes and was a tremendous help. And that's our RPW. Thank you.